Hello, my name is Kathleen Lisson. I just attended the WUIP World Congress in Buenos Aires, Argentina. I am a lymphedema therapist, and I'll say for this one, I'm also a yoga teacher. I'm a meditation teacher. I practice meditation. I practice yoga personally. So I was really, really excited to attend the pre-Congress conference on regenerative medicine. And they talk about also the acronym PNEI, or regenerative medicine. So I took a whole page of notes and I want to briefly go over them with you. I hope that this will be an inspiration if you want to do a deeper dive into research on any of these topics. So they kind of began with the description of why in this conference of vein surgeons, of lymphedema therapists, why are they talking about regenerative health? And they talked about health as the ability of the system to adapt. So you're healthy if you can adapt. And resilience is the ability of the system to adapt to change. So, very similar, we're looking for our clients to have health, to have resilience, and we need to build resilience in our clients because that will increase adherence to the treatments that they have to do, the self-care, the self-management that they have to do. And the role of the healthcare provider is to help the client adapt. So that we went over that as just our general philosophy of why that we were there. And then they went into why do we age? And they talked a lot about inflammation, mitochondrial dysfunction, stress axis hyperactivation, oxidative stress, and then telomere shortening. So these plus other things were discussed on why does the human being age. Um, they really focused on the fact that 75% of health is based on the client's choices. So it's lifestyle. Genetics plays a part, but the vast majority, the biggest part, and the epigenetic part is lifestyle. It's lifestyle. It's focusing on some ways that you can improve your lifestyle as the client. But they did do a really great job of talking about adverse childhood experiences, which I've been talking about for the past couple of years. And they actually even narrowed it down to the first 1,000 days of a child's life. The first 1,000 days of a child's life, if they have trauma, they will get an exaggerated stress response. They will possibly get chronic cell inflammation and oxidative stress. Adverse childhood experiences also impact decision making. So it's their ability to make the correct, proper decision for their health. And as we just said, 75% of health is based on the client's choices. Um, and they looked into research, which I have seen previously. Chronic stress and low resilience increases the incidence of several cancers. So that's something that can possibly inspire our clients to help take a hold of their stress and reduce it, increase their resilience. But also, we need to understand, especially as lymphedema therapists, often our clients are coming to us after the cancer diagnosis and treatment if they have lymphedema. We should understand that chronic stress and low resilience can increase the incidence of several types of cancer. So the client that comes to us may have chronic stress and low resilience. And then this is our ability to, again, the role of the healthcare provider is to help the client adapt, teach them these strategies. Um, but it's important, and they talked about it. Don't delegate your health just to doctors, just to pills in a bottle. They have to take the responsibility for themselves because 75% of the health is based on the client's choices. And one way that we can have them measure their progress in their stress reduction in this psychoneurobiology, PNEI interventions that they're making to help themselves be healthier is heart rate variability testing. So heart rate variability testing can monitor their progress. And also if you have heart rate variability changes, it can possibly predict disease progression. So it's important to understand, have the client understand that this is something that they can, it doesn't just have to be subjective, like, did I feel good after that meditation or that salad? You can measure your progress with heart rate variability testing. So they talked about psychoneurobiology, and the acronym they used is PNEI. So how can we improve PNEI? And the results that they talked about, nothing is incredibly surprising. This is all really good advice. This is all something that we can confidently talk to our clients about. The first one is love yourself and have an increased amount of happiness in your life. They talked about meditation and mindfulness. They talked about breathing and that slow breathing of 6 breaths a minute to help balance the nervous system. They talked about the power of prayer. They talked about dance, yoga, Tai Chi. They talked about nutraceuticals. They talked about acupuncture. They talked about the concept of hormesis. And I put in under the topic of hormesis things that people were talking about throughout the day: calorie restriction and fasting, physical activity, and polyphenols like turmeric and caffeine, all things that you can do to activate the benefits of hormesis. They talked about taking a sauna either weekly or daily. And I don't know, that could probably be hormesis as well. They talked about the power of sunlight. And I know Andrew Huberman talks about that a lot. That's something me and my husband talk about, is the power of getting sunlight onto the skin, the effect of sunlight on the emotions, on being happy, on the health of the body. Also, the microbiome. They talked about the importance of the microbiome. They talked specifically about kefir, pro and prebiotics, turmeric, among other things that could possibly help the microbiome. And they talked about stress management, sleep, and gratitude as things that the clients can do, because 75% of the health of the clients is based on their choices. And it shouldn't just be delegated to the doctor told me to do this, or I go to all my doctor's appointments and I take all my medication and I get all my surgery. It has to be these PNEI, these wellness and actions, self-care actions that they can take to increase their health and increase their resilience. They also briefly talked about folic acid, and the MTHFR mutation can potentially result in poor folic acid metabolism, and accumulated folic acid and deficient B12 is bad. So that's something that is really deep. You can really go down the rabbit hole of searching for that if you want to learn more about that. They talked about the benefits of melatonin. They talked about maqui berry, which is something that I hadn't heard of before, but is an antioxidant polyphenol. They talked about the benefits of amla, and they talked about the benefits of mitochondria targeted therapy. So these were all the things that were talked about in this regenerative medicine advanced session, the pre-course, before the WUIP World Congress that was held in Buenos Aires, Argentina. Thanks, and have a great day.